Bismillahirrahmanirrahim. The today's quote is Allah's timing is perfect in every matter. We don't always understand the wisdom behind it, but we have to learn to trust it. Today, the topic of discussion is sources of water supply and sanitary well. I am giving this presentation under the kind supervision of Professor Dr. SAIRA. The learning outlines of today's presentation will be introduction to the water supply and sanitary well, sources of water supply, various types of water supply sources, sanitary well, recent updates, and at the end all the MCQs. By the end of this presentation, participants will be able to describe the source of water supply, various types of water sources, and the sanitary well. No, the sources of water. What may be abstracted from the number of points in the moment of the hydrological cycle, safe yield. Yield that is adequate for providing the 95% of the year. Safe yield of water source must be sufficient to serve the population expected at the end of the design period, that is 10 to 50 years in the future. Criteria for the water sources. First criteria is the quantity and the second one is the quality. First, the quantity must be sufficient to meet present and future requirement, and the second is the quality of water must be acceptable for the population. The main source of water is the rain. The second one are the surface water, which includes importing reservoirs, river streams, tanks, ponds, and lakes. And the third one is the groundwater that includes shallow well, deep well, and the springs. This is the water cycle. The main source of water, that is rain, that forms by the evaporation of the water on the ground. When it rains, the glaciers, streams, the rivers, farms, and at the end oceans are formed, and ultimately it sinks into the groundwater. So this is the whole cycle of the water. The characteristics of rainwater are it is that it is purest water and it is clear, bright, and sparkling in nature. Chemically, it is very salt water, contain only traces of dissolved solid, that is 0.0005%, have a cross fraction on lead pipes. Bacteriologically, rainwater from clean districts is free from pathogenic agents. The impurities in rainwater has suspended impurities from the atmosphere such as dust, soot, and microorganisms, gases such as carbon dioxide, nitrogen, oxygen, and ammonia. Surface water, it originates from rainwater. Main source of water supply is its rain. The example includes the rivers, lakes, tanks, man-made reservoirs, seawater prone to contamination from human and animal sources, never safe for human consumption unless subject to sanitary protection and purification before use. Now, the impounding reservoirs. The artificial lakes in which large amount of surface water is stored. Area draining into the reservoir is called the catchment area. Furnish good quality of water. Characteristic water is clear, potable, and ranks to rainwater impurity. Water is usually soft and considered to be free. It drives impurity from catchment area, so keep catchment area free from human or animal intrusion. Its disadvantage is that growth of algae and other microorganisms from long period storage of water impart wetness and odor. So the rivers, they furnish dependable supply of water. It is clear in other season, but turbid during the rainy season. Contains dissolved and suspected impurities of all kinds. Bacteriological count and human intestinal organisms are high. Rivers. It drives its impurity from washing sewage, sewage, water, industry and agriculture waste, and trade was. It gets self-purification by certain amount. Self-purification of river water of certain amount occur in river water by natural process of purification that includes dilution, sedimentation, aeration, oxidation, sunlight. It may get polluted by plant and animal life, and it needs purification for drinking purposes. So the tanks. These are large excavations for storage of water. It is a recipient of all kind of contamination, full of slate and colloidal matter and aquatic vegetation. It is used for washing of clothes, cattle, human cooking pots, swimming for children. Tanks are subject to unlimited possibilities of contamination and are highly dangerous due to deification around the edges of the tank. It is responsible for a large number of cases of sickness and death, especially of children after drinking tap water without boiling, disinfection, or any other treatment. Improvement checks can be done by certain methods which includes oxidation storage, but they are not sufficient to render water safe. Another precaution for improving sanitary quality of tank water. This includes edges of tank should be elevated to prevent entry of the surface washings. There should be fence around the tank to prevent access to animals. No one should be permitted to get into the tank directly. There should be elevated platform from where the people can draw water. The weeds should be periodically removed and the tank should be cleaned at the end of the dry season. The issues associated with the tank water includes it is not possible to prevent pollution of tanks as the people who consume tank water are porous and not having sanitary concepts. Considerable reachable ongoing, national plus international, and that is to ensure village tank water safe for drinking. The simplest solution is that for its making it drinkable is that sand filtration of tank water plus addition of the chlorine. Seawater. Though the source is plentiful, but it's usually limited because it contains 3.5% of salts. Its salt concentration is 30,000 to 36,000 milligram per liter of dissolved solids, including 90,000 milligram per liter of chloride, 10,600 milligram per liter of sodium, and 1270 milligram per liter of magnesium. Desalting and demineralization process involves heavy expenditure adopted where seawater is only available source. This is the picture which showing the desalination of the seawater. Groundwater. Rainwater percolating into ground from groundwater. Cheapest and most practical means for providing water to small communities. It is superior to surface water because of effective filtering medium. This picture showing the groundwater. The water sinks into the ground and from there the people can get groundwater. Its advantage is that it's free from pathogenic agents, it requires no treatment, its supply is likely to be certain even during dry season, and it is less subject to contamination than surface water. But its disadvantages are that it's a high mineral content, for example, salts of calcium or magnesium, which enter water hard. It requires pumping or some arrangement for lifting the water. The sources of groundwater are the wells that may be shallow and deep wells and the dug and tube wells. Shallow wells. The taps of soil water from above the first impervious layer in the ground. Impervious layer is the impermeable layer. It yields limited quantities of water. Water is notorious liable for pollution and contamination from neighboring latrines, urinals, drains, cesspool, soakage pits, and manure collection. D wells. Taps water from the water being stratum below the first impervious layer in the ground are usually machine dug and several hundred meters deep. One is safest water become health hazard if it is open, poorly constructed, and not protected against contamination. This picture showing the shallow well. This is a shallow well that is above the level of the first impervious level. The strip in this brown is the first impervious level, and the below area is the groundwater that is above the first impervious level. So the shallow water uh, takes its water from the this is these are the differences between the shallow and deep well. Um, the chemical quantity of the shallow well it is that water is moderately hard, but in deep well it is much harder. The bacteriology quantity or quality of the shallow well is that it often grossly contaminated, but in deep well it is pure, and the yield. The shallow well is dry in summer, while the deep well remains the constant supply of water. Know the artesian well. It is a kind of deep wells in which the water rises above the level of groundwater because it is held under pressure between two impervious strata. Saline intrusion. Infiltration of seawater into the deep well and it gives blackish taste to the water. This is the picture that showing the artesian well. The artesian well is the water that is coming out of the groundwater because of the pressure between the two impervious layers. And this is the this picture showing the intrusion of the seawater. The seawater gets its entry into the groundwater when we get water from near the sea. Improvement of duct wells. Unlined kacha wells may be made sanitary by dipping the bottom, installing a hand pump with screen, filling a well with coarse sand up to the water level above the clay above the level. A platform and drainage construction after the consolidation of material. Masonry well improvement, making the upper 10 feet or above of the lining water tight, raising line of 1 foot above the ground, providing a reinforced concrete slab cover at the top, installation of one or more hand pumps for water lifting, special ventilation to foundation of the pump to prevent any possible leakage of water into the well. Now the sanitary well. A sanitary well is the one which is properly located, well constructed and protected against contamination with a view to yield a safe supply of water throughout the year. Now the criteria for this is a picture that's showing the criteria for construction of the sanitary well. First, we have to decide its location. Then we have to form its lining. Then we have to form its parapet wall. This is the wall that is above the ground level. That is usually considered 1 to 2 feet above the ground level. The second is the platform from where the people stand and uh, get water from the well. Then we have to cover the well by the concrete. Then there is a drain, that is the seepage water that's its entry into the drain. Then we have to install a hand pump to get water out from the well. Then there is the consumer responsibility, and the last is the quality of the water. Construction of a sanitary well. First, for choosing the location, we have to choose a proper location. Well should be located not less than 15 meter or 50 feet from the likely source of the contamination. At higher elevation, with respect to possible source of contamination, so located that no user will have to carry water for more than 100 meters. So the septic tank should be 50 feet away from the sanitary well. And the consumer's house or the population should be at least 100 meters away from the sanitary well. Now the lining. It should be built of bricks and stones in the cement up to a depth of at least 6 meters or 20 feet. So the water enters from the bottom and not from the side. It should be carried 60 to 90 centimeters, 2 to 3 feet above the ground level. Uh, this is the area which is called the parapet wall. This is the diagram which is showing the sanitary well. This is the parapet wall that is 2 to 3 feet above the ground level, so that anything cannot get its entry into the well. This is the lining of the well, that is baked out of concrete or the bricks or the cement. This is the ground level. This is the permeable level, and this is the impervious level. The whole lining of the well is made up of concrete, and water gets its entry from the bottom. Now the cone of filtration. It is the imaginary prismatic inverted cone shaped area around the well through which water is drained into the well. Inverted site at the base of the cone is at the ground surface around the well, from which the surface water, rainwater, can percolate down and can enter the well from the side walls and bottom of the well. Its apex is formed by the bottom of the well. Radius of the cone of filtration is 4 times the depth of well, about 15 to 30 meters, that forms about 50 to 100 feet. This is the cone. This is the cone of filtration. This is the well, and it is uh, about 4 times the depth of the well. When the water is drawn from the cone of the filtration well should be constructed 50 to 100 feet away from the source of the pollution. If there is any contamination or the pollution in the well, water its origin can be traced in the area of the cone of the filtration. The construction of sanitary wells. The parapet wall around the well up to the height of at least 1 feet, 2 to 3 feet should be provided above the ground, and its platform along with the parapet wall. The platform should be made with cement concrete extending at least 1 meter in all directions. It should have gentle slope outward, leading to a drain with along with its edges. This is the parapet wall. This is the diagram that is showing the parapet wall and the platform. This is the slope of the platform. Now the drain. A poker drain should be built to collect the split and dirty water from the platform or the well, and this should be a channel to the drain or soak pit that is away from the well. Now the covering. The top of the well should be covered well by cement concrete cover to avoid direct contamination. This is the covering of the well. Now the hand pump. A good sanitary well should be equipped with a hand pump to lift the water in a clean manner. When such a facility is not available, it is desirable to attach a chain with the bucket to the well for the common use. This is the installation of the hand pump. Now the consumer's responsibility. The using sanitary well does not guarantee freedom from waterborne disease unless the consumer observes certain basic precautions at the individual and at the family level. Strict cleanliness should be enforced in the vicinity of the well. That includes the personal populations, washing clothes and animals should be avoided. Dumping of refuse and waste should be prohibited. Ropes and buckets from the individual home should not be used to draining or supply from the well. Water from the well carried in the clean sanitary vessels to the individual houses. All these require health education. The quality, the physical, chemical, and bacteriological quality of water should conform to acceptable standards of quality of safe and wholesome water. Know the tube wells. These are the safe and cheap sources of the water. A tube well is a type of water well in which a long 100 to 200 millimeters or 3.9 to 7.9 inches wide stainless tube or pipe is bored into an underground aquifer. The lower end is fitted with a strainer and a pump lifts water for irrigation. The required depth of the well depends on the depth of the water table. There are two types of wells that are shallow tube wells and the deep tube wells. Shallow tube wells are cheap, while the deep tube wells are costly and but they give a good quantity of water. Now the shallow tube well. Tube wells have their depths limited to about 30 meter and may have a maximum yield of about 20 meter cube per hour. On the other hand, tube wells may have a maximum depth of about 600 meter and may yield more than 800 meter cube per hour. Different methods are used for the construction of shallow and deep wells. These are the diagrams that are showing the shallow and the deep wells. Springs. When the groundwater comes close to the surface and flows freely under natural pressure, it is called spring. It is easy to exploit as no pumping required but exposed to contamination. Shallow springs dry up quickly during summer, while the deep springs do not show seasonal fluctuation. Now the time for the recent updates. First articles that I include is the assessment of municipal solid waste landfilling practice on the groundwater quality and associated health risks. It is a case study for Mardan, Pakistan. This study was conducted to investigate the effects of municipal solid waste used as landfilling on the groundwater quality and health effects on the community. The study was carried out in Mardan, Khyber Pakhtunkhwa. To assess the effect, 13 groundwater samples were collected from solid waste dumping sites and 13 from safe sites. Groundwater was analyzed for pH, turbidity, electric conductivity, total hardness, for the contents of the chloride, calcium, potassium, iodine, nitrogen oxide, sulfates, and heavy metals such as lead, chromium, manganese, copper, nickel, and others. Biological parameters such as protocoliform bacteria. Waste sample collected from uh, solid waste dumping sites showed that food and garden waste were present highest percentage by weight, and that is 30.5%, followed by the fines 17.3%. The two graphs, the solid waste disposal sites and the sanitary sites differ significantly for the parameters like electrical conductivity, total hardness, the electrolytes, and the uh, heavy metals. Samples collected from solid waste disposal site, that is 84%, were found contaminated with, with total coliform range 2 to 22. It was observed that pH, electrical conductivity, and the electrolytes and the heavy metals were more in the sample collected from 70 to 130 feet than 142 to 100 feet. Total coliform found in 70 to 80 feet depth was significantly different from rest of the group. Similarly, significant differences regarding different parameter for various depths was found for potassium, iodine, calcium, nitrogen oxide, lead, copper, and ferrous. The results of the questionnaire survey revealed negative correlation between the disease and the distance from the landfilling sites, and significant correlation was observed for typhoid, cholera, skin allergies, and gastroenteritis. This study confirmed that using manual salt waste management as a fill matter has contaminated the groundwater quality, and leveling of land through municipal solid waste is not safe. Deep drilling is recommended for extraction of groundwater in the contaminated area to minimize the associated health risks. Assessing potable water quality and identifying areas of waterborne diarrhea and fluorescence health risks using special interpolation in Peshawar, Pakistan. Waterborne diseases have become one of the major public health concerns worldwide. This study is aimed to investigate and develop special distribution mapping of the potable water quality parameters in the city of Peshawar. A total of 108 water samples collected across The entire study area was subjected to physiochemical and biological analysis. Tested parameters include pH, turbidity, temperature, fluorine concentration levels, and bacterial counts. That is fecal coliform. Inverse distance weighting, interpolation in geographic information systems was used for spatial analysis. Test result with that 48% of water samples had fecal coliforms count, that is per 100 ml, greater than World Health Organization minimum limits, while 30%, 31% of the samples have fluoride concentration in excess of the in excess of the WHO maximum guide values. Special distribution mapping was developed for fecal coliforms count and fluoride ion concentration using ARCGIS to highlight the high-risk settlements in the study area. Results showed that around 20% area under fecal coliforms and approximately 30 to 33% area based on fluoride concentration fall under the need for treatment category. The pH and turbidity were found in the compliance with WHO desirable limits. The sanitary inspection score significantly depicted that ineffective multi-barrier approaches consequently deteriorated the water quality at the consumer's end. Finding from the present study shall be useful to for inspecting or adopting the necessary remedial measures before it will affect public health. Now the time for the MCQs. A team of philanthropists wants to build a sanitary well in the XYZ rural community because access to the safe water for people is very low. Many people in this community are illiterate and have no concept of proper dumping or refuse and waste. What will the location of the sanitary well constructed area from the likely source of contamination, whether it will be 10 feet, 20 feet, 30 feet, 40 feet, or 50 feet away? It should be 50 feet away from the sanitary well. So the option E is the correct option. Second MCQ is a great proportion of cases and deaths due to gastroenteritis have been reported in the XYZ community for the last 3 years. A public health team visited the community and found out that there is a lack of proper provision of safe drinking water through pumps and pipes. The community mostly used stored surface water in large excavations for washing clothes, cattle, and cooking pots for drinking purposes. What is the main source of water responsible for gastroenteritis in this community, whether importing reservoirs, lakes, ponds, rivers, or water tanks? The water tank option E is the correct option, and the water tanks are most uh, easily polluted by the inhabitants. Question number 10. A public health team and the experienced microbiology teams visited the source of water supply in the XYZ village. They found that the water tanks are the main source for domestic and drinking purposes in the village. Upon inspection, team found that the tank is full of slate, colloidal matter, and aquatic vegetation. What will the simplest method for filtration of tank water in the poorest community, whether by oxidation, reverse osmosis, sedimentation, slow sand filtration along with chlorine or water softeners? The simple method of filtration water tank is by slow sand filtration along with chlorination. Fourth MCQ is an XYZ city near the sea in the country has faced problems of water depletion due to increased population growth over the last 10-year decades. Traditional groundwater and surface water sources have been overwhelmed according to water utility companies, municipalities, and water management districts. Our team of philanthropists visited the city and wanted to provide enormous funds to meet the water depletion problem. Which source of water can be adopted in this scenario, whether importing reservoir, lakes, ponds, rivers, seawater after desalination treatment processes? Its correct option is E, seawater after desalination treatment process at the city is near the sea. They can easily use the seawater. Fifth MCQ is a small ABC community has been facing a shortage of water supply for the last few years. What source of water can be adopted in this community which should be the cheapest and free from accidents, whether groundwater, importing reservoir, lakes, ponds, or the rainwater? The correct option is A, that is groundwater. Sixth MCQ is a group of masons in the XYZ community constructed two wells after visiting and funding the philanthropists who found huge water depletion problem in the community. The constructive wells tap water from the water bearing stratum below the first waterproof layer in the ground. What is kind of constructive well in the community, whether artesian well, bored well, deep well, shallow well, or the tube well? It's deep well, as the deep well is below the first impervious layer. Seventh MCQ is a local health department and water well systems professional in the XYZ community tested a well water sample and found the coliform bacteria in the water. The people in the community also reported the increased cases of gastrointestinal illness predominantly among pregnant women and children from the last few years. Which type of well in the XYZ community is most likely responsible for these health hazards? Whether artesian well, bored well, deep well, shallow well, or the tube well? It's shallow well, as it is most likely to be contaminated. Recently, a team of public health engineers inspected a private well in the XYZ community and found suspicion of leakage of waste from the underground storage tanks and mixing with the well water. People of the community who consume well water for drinking purposes are also experiencing increased symptoms of gastrointestinal, liver, and nervous system disorders. Which part of the well will be mainly useful to find out the source of water pollution, whether cone of filtration, hand pump, lining of well, parapet wall, or the platform? It's A from the cone of filtration. Ninth MCQ, a well-constructed and well-located sanitary well is constructed in the ABC community by the philanthropist. A well is also equipped with a hand pump for lifting the water in a sanitary manner. As a public health practitioner, which cost-effective mode of intervention you should mainly advise the consumers of sanitary well to avoid waterborne disease in the future, whether chemoprophylaxis, economic intervention, health education, immunization, or nutrition intervention. It's the most cost-effective will be the health education. Last MCQ is an XYZ village uses river water for residential and drinking reasons. No local city or municipality focuses on community concerns. Our team of public health professionals visited the community after getting philanthropic support. They plan to construct a 100 to 200 millimeter diameter stainless steel or pipe into a underground aquifer. Which type of water well do they intend to build? Whether artesian, deep well, sandy well, shallow well, or the tube well? It's deep well. This is a Kio's MCQs. This is our YouTube channel where all the presentations of the postgraduate residents are uploaded here. And thank you very much for today's presentation.